This is TTT Live. I am DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning. I am delighted that you have decided to tune in to today's virtual media conference, which updates the public on the Ministry's COVID-19 initiatives. Sharing the latest COVID-19 updates with you today are Dr. Avery Hines, Technical Director of the Epidemiology Division, Dr. Janine St. Bernard, County Medical Officer of Health for County Caroni, and Mr. Roshan Siram Singh, GIS Manager in the Epidemiology Division. I am Candice Alcantara, Manager Corporate Communication at the Ministry of Health, and I will moderate this morning's media conference. Dr. Hines, please give us the epidemiological and clinical updates this morning.
Thank you, Ms. Alcantara. Good morning to my colleagues, Dr. St. Bernard and Mr. Siram Singh. Good morning to members of the media and members of the viewing and listening public. The clinical update for the day ended March 2nd at 4 p.m. is as follows. At that date and time, there had been 97,783 tests conducted between the public and private systems. Of those, 7,717 would have tested positive, and of those having tested positive, we currently have 7,481 recovered patients. There are 97 active positive cases at this point in time, distributed as follows. There are 15 patients currently hospitalized, 76 in home self-isolation, and 5 in step-down facilities, with the extra 1 coming from the testing that would have gone on between 48 hours ago and the 2nd of March. So we had 1 case turning positive or testing positive in the tests conducted during that time frame. We remain at 139 fatalities, and we continue to extend our condolences to the members of those bereaved families. The breakdown of those that are currently hospitalized is as follows. We have 12 patients in the Couva Multi-Training and Medical Facility, 3 of whom are in ICU. There are 3 patients outside of Couva, 1 at Cora Hospital and 2 at the Scarborough Regional Hospital, and those who are in step-down are all at the UEDB facility. That ends the clinical update. I'd like to go straight into the epidemiologic update. So if we can have the first slide, in fact, let's have the second slide. The second slide shows the, please, thank you, remove the ticker. The second slide shows the epidemic curve, that epidemic curve trending from the 1st of August all the way through to today's date, and emphasizing again that we have had that constant decline in cases between the peak of the outbreak around the middle of August and the current date. And even though we are seeing these lower numbers, we have a current rolling 7-day average of about 5 cases a day. We do want to continue to emphasize that the virus is still in circulation in the population, as we can see with the totals having over 560 cases at this point in time. Now, the other important thing to note is that the cases that we see, the cases that we count, the cases that show up in the health system and get counted are the ones that are symptomatic and that present. And we continue to emphasize the public health importance of those asymptomatic cases which may not be detected but which continue to pose a risk of spread, and continue to emphasize the importance of the public health measures, most importantly the mask wearing, physical distancing, and hand hygiene, as it's been termed the 3 W's: wear your mask, wash your hands, watch your distance. Let's move to the next slide. Demographically, the information remains largely the same, about 53% male, and the majority, over 55%, being in that working age group of 25 to 49. While, next slide, among the fatalities, we have that 3-to-1 ratio of men to women, 74% men. We do have the majority of those cases being in the over 60 age group, but there are individuals in younger age groups who have had fatal outcomes, and one of the common features is that we've had those individuals mostly having other pre-existing conditions which we call comorbidities, and which include diabetes, hypertension, kidney disease, etc. So we do want to emphasize the importance of being aware of your coexisting vulnerabilities and taking all the steps necessary to prevent yourself from becoming infected. Today I'm not going to go into the geographic distribution because there's actually a separate presentation on that. So I'm going to turn you back over to Ms. Alcantara.
Thank you very much, Dr. Hines. In the last conference, we reminded the public that although thankfully our numbers are low at this point in time, COVID-19 is still present in Trinidad and Tobago, and we all have to remain vigilant. And so we have brought back Mr. Siram Singh to the program, and he will highlight the way that we have been using our technical resources to track national COVID-19 trends. And you will see that COVID-19 is still here.
Thank you, Ms. Alcantara. Good morning, Dr. Hines, Dr. St. Bernard, Ms. Alcantara, members of the media, and our listening and viewing audience. As we go across our first slide, we'll begin to take a look at what the cases look like, or what it would have looked like over Epi Weeks 5 to 7. Just to be clear, Epi Week 5, Epidemiological Week 5, covered the period the 31st of January to the 6th of February 2021. Epidemiological Week 6 covered the period 7th of February to the 13th of February. And Epi Week 7 covered the period 14th of February to the 20th of February. So as I speak of the Epi Weeks going forward, these will be specific periods which I refer to. As we take a look at the map, this is the first of two maps which look very similar. And this is a point map which represents the location of cases over the period Epi Weeks 5 and 6, with Epi Week 5 being represented in the purple dots and the purple bars in the chart, and Epi Week 6 being represented by the yellowish-orange dots and the yellowish-orange bars in the chart. What we can see quite clearly is that St. Andrew, St. David, Nariva Mayaro, and St. George East generally would have recorded a smaller number of cases than the other counties in Trinidad, while during this particular period, which we refer to being Epi Weeks 5 and 6, Tobago would not have recorded any new cases at that point in time. What the map also tells us, and also shows us quite clearly, is the number of cases that would have been recorded in County Caroni and County Victoria, and is also represented in the charts, as you could see there. As we switch across to the other slide, we'll see now the map which represents the period Epi Week 6 and 7. So there's that overlap with Epi Week 6. Epi Week 6 representing the period the 7th to the 13th of February, and Epi Week 7 representing the 14th to the 20th of February. Again, we see fewer cases in Nariva Mayaro, St. Andrew, St. David, and St. George Central, with again more cases in Caroni and Victoria, again represented by the bar charts. Just to point out that these are point maps, so in the event that there were cases within the same home, the point would have been located on each other, so they would have been overlaid on each other, so you would not necessarily be able to determine where they would have been spread within the home, or they would have been clusters using this particular map. But we'll get to that shortly. I'll point out as well, given that the lower numbers which we have recorded, as Dr. Hines would have mentioned, and we would have seen in the epi curve, while there may be lower numbers, there is no place for complacency, and we need to continue to be vigilant as we proceed. Now, as we move across to the other slide, we take a look at County Caroni. Now, I mentioned earlier that the period represented here would have been Epi Weeks 5, 6, and 7, covering the period 31st of January to the 20th of February. Not represented here is Epi Week 8, which, if we were to represent on the map, would show a higher number of cases in County Caroni compared to Victoria over that particular period. Now, what we are seeing again here, cases spread across the county, more so in areas which are highly populated and along road networks which have population settlement, with a few cases spread across other parts of the county. As we take a look at the other map, which also represents County Caroni, this time for the period Epi Weeks 6 and 7, we see again cases represented as would have been previously, with the purple points represented in this case Epi Week 6 and the yellow points representing Epi Week 7. Again, cases in the more populated areas, but there are also being cases scattered across the county, which would not have been closer to any of the other cases. As we move across to the next slide, we'll start taking a look here at County Victoria. Again, same visualization. Epi-week 5 in this case being represented in purple, Epi-week 6 in yellow, and same pattern with cases being recognized and noted more so in the populated areas and along the road networks which we have settlement, with a few others scattered around the county. A similar pattern was seen again in Epi-weeks 6 and 7, again with 6 being the overlap, with cases being spread across the county scattered, and in a few cases more so in the populated areas. Now we move across the county St. Patrick. We could go again. As we go to County St. Patrick on the other slide, we would see less cases, but again, a few cases in different parts of the county. In this case, we're seeing it more so along the road networks. This particular map represents the period Epi-weeks 5 and 6. As we move across the Epi-weeks 6 and 7 in the other map, we'll see again a few cases scattered across the county, more so in areas where there are higher populations or along the road networks. Now, this is just one of the ways in which we've been looking at the data, point data. We would not have presented many maps in this particular format previously, but we thought it useful to share this with the country so you could understand that we are looking at the data in different ways, analyzing the data in different ways, and of course, using it to make decisions in different ways. As we move across to the other map now, we'll see a heat map, which actually shows us the spread of cases. Again, during the periods Epi-weeks 5 to 7, the period Epi-week 5 to 7, showing us where we have the higher density of cases in that central area and in that southern area in County Victoria. They're closer to the San Fernando area. We're looking at the bar chart again, which accompanies the map. We see County Victoria and County Caroni having recorded higher number of cases compared to the others. Again, just to be clear, this is Epi-weeks 5 and 7, 31st of January to the 20th of February, during which period they would not have had any cases in Tobago. The case in Tobago, which would have been recorded over the weekend, would not be represented on this particular map, or these maps, I should say. Now, looking at this heat map, as we take a look at the other map now, we realize that there is some amount of agreement, some amount of congruence between the maps when we look at where we have the clusters and where we have the higher density of cases. Now, this cluster map is a bit different from the previous maps which we shared. Whereas previously, the criteria used would have been a minimum of 4 cases over a 2-week period within a 1-kilometer search distance. That would have been the criteria to determine if there's a cluster or not. Given the decrease in the number of cases, we actually had to drop the minimum number of cases required to be considered a cluster. In this case, we dropped it to 3, and the period used was not 2 weeks, but 3 weeks of data, Epi-weeks 5 to 7. Again, it's a good sign. Of course, the numbers went down, so that is positive. But we continue to urge the population to continue to be vigilant as information continues to come. And it's important for us to analyze what we have and not become complacent and misinterpret the data that we have into thinking that all is well and we can revert back to how things were previously pre-COVID. Now, looking at this particular cluster, we are seeing this cluster map, we are seeing 5 clusters. 2 in County Victoria, which in this particular case represent the general San Fernando proper and Union Hall area. We are seeing 1 in County Caroni in Chaguanas proper along that Montrose area. We are also seeing 1 in County St. George East in the El Dorado Tunapuna area and 1 in Diego Martin. You will recall the last cluster map shared, which would have been at the end of January, would have shown 7 out of 14 clusters at that point in time in County St. George East. So we are seeing the changing patterns as the number of cases decrease as well. And we continue to use the GIS in various ways to support the decision-making process across the county, the counties, and the country at large, as it provides us with the opportunity for evidence-based decision-making as we allocate resources, etc. As we switch to the next slide, we see a little bit of a breakdown of these 5 clusters. Again, we are seeing smaller numbers in the clusters now compared to what we saw before. In cluster 1, we saw essentially 3 out of the 3 cases coming from the same house, and they were actually family members. In cluster 2, 2 out of the 3 persons appear to come from the same street. However, we are unsure if they are related. And that actually has to do with the information that was provided, and I'll come back to the need for solid information. Cluster 3, 6 out of the 8 persons were actually from the same home, whereas in cluster 4, 5 or 6 persons appeared to come from the same house. At least 4 of these persons were family members, whereas in cluster 5, all members of that particular cluster were from the same home. Now, coming back to the need for solid information, we need to get complete information. As we move forward, we have less cases now, which allows us to drill even deeper into the data. There is a need for us to get a better understanding through the contact tracing process. So we are asking the public to cooperate with the contact tracers as we go through the process to understand where you are, where you have been, places visited over the last, in this case, 14 days, which we ask for. And we need to get that information so we could trace persons to locations. In the event that we are looking at spread taking place at public spaces or in the workplace or anywhere like that, giving us an indication of where you would have visited or where you would have been over that particular period of time will help us to understand what is taking place, and it will help us to appreciate any linkages among the cases which may occur. So with that, I would say thank you very much as I hand over back to Candice.
Thank you very much, Mr. Siram Singh, and he gave us a national picture or a macro perspective on COVID-19 in Trinidad and Tobago. And now we will drill down into County Caroni and get an update from Dr. St. Bernard on some of the COVID-19 trends that are happening specifically in the County Caroni area.
Good morning Trinidad and Tobago. Good morning, Dr. Avery Hines. Good morning, Mr. Roshan Siram Singh. Good morning, Ms. Candice Alcantara. Good morning to the media and to the viewing and listening public. Today I have the great pleasure of presenting an update on County Caroni in particular, because of course we had the honor of having one of the highest number of cases within Trinidad and Tobago. Before that, I will emphasize and state what Dr. Hines has said before, which is that COVID-19 is still very much present in Trinidad and Tobago, and so we need to continue to remain vigilant and adhere to the COVID-19 protocols to protect ourselves and our loved ones. We do have low COVID-19 numbers at this time, which suggests we are doing well as a nation, but we do need to continue with the COVID-19 protocols of the 3 W's, as Dr. Hines said: wear a mask, wash our hands, and watch our distance. So, coming back to Caroni, the reason that I'm here. So Caroni, in terms of location, is located south of the St. George County, and St. George, as you know, is St. George West, Central, and East. We are also west of the river, and we are north of County Victoria. And within County Caroni, we have the 2 large towns of Chaguanas and Couva, as well as the Point Lisa's port. In terms of the breakdown of figures for County Caroni and the community cases that we have, as of yesterday, the 2nd of March, we had 26 active cases, and this represents the 2nd highest number for the country, of which only 1 was a new case. We had 1 discharge, and of the 26 persons, 10 were symptomatic and 16 were asymptomatic. In terms of the trends within Caroni, we had a lovely look at those maps. I will just give simple numbers. At the start of February, County Caroni saw 44 active cases, and at the end of February, we went down to 25. And for the month of March, we've had 26 for both days, the 1st and 2nd of March. So we are going down, but we still are among the higher numbers. In terms of the clusters, as Mr. Siram Singh had mentioned, we have had couples, we've had parent and child, and we've also had individuals within the county. At this point, we have a couple, and we have a family of 3, as well as individuals, contributing to that number of 26. So within County Caroni, some of the issues that we would have identified contributing to the number of cases reside within the workplace. So I just wanted to speak a little bit towards the issues within the workplace. And the information I'm sharing is based on information we would have received as a result of contact tracing. Our contact tracing persons, when speaking to individuals, the persons were happy and very willing to share that because they work with the same persons every day and they are very comfortable working with them, the practice has been in some, not all organizations, but within some, they say that when they get to work, they take off their masks and they work together, and then before they head out, they would put the mask back on before leaving the office. So of course I would want to state that this is a dangerous practice. And this is something that has been happening not just in the public sector, it happens in the private sector as well. So there are different business places that have had this as a practice because we get comfortable with each other and we start to treat our colleagues maybe as household members perhaps. So that is something we need to be careful with. The other issue that has come to the fore in investigating why we have so many cases, we've had issues with the gatherings, the parties and the functions. So what happened at those events is the usual eating, drinking, close proximity, and not wearing a mask. So that represents two of the W's, not wearing the mask and not watching the distance. So of course that's another issue we need to be careful with so that we can look to reducing our figures and not having them continue to rise. So in as much as I've identified that mask wearing seemed to be the issue, I will take a moment to mention good masks, bad masks, how to wear your mask. Medical mask or surgical mask, like what you would have seen me wearing when I came in, right? Those are the medical masks. Those are considered suitable for preventing COVID-19. Masks that fit snugly, meaning over the nose, over the chin with no gaping holes, those are suitable. Masks with breathable fabric, such as cotton, those with tight woven fabric, and those that have at least 2 layers. So the masks, of course, that will not be suitable would be those that are made from materials hard to breathe. Sometimes you put the mask on and then realize, but there is no exchange of air. Masks made from fabric loosely woven. So I have seen people with knitted masks, crocheted masks. Those are not suitable and will not protect anyone. Masks that have 1 layer, which I have seen for sale. We need to not purchase masks that only consist of 1 layer of material. Masks with exhalation valves. I've seen athletes running looking very, confident, but we don't want masks with exhalation valves. And of course, the classic which I've seen, which is always alarming, is seeing the person stop suddenly, run out of the vehicle to buy something at the side of the road with no mask. So they pull their jersey or their top over their face and they think that that's a mask. That also will not protect us from COVID-19. Masks only protect you if you wear them well. I know you've heard it before, but I need to say it again because the not wearing the mask did contribute to the cases within County Caroni. And when we wear our masks, we still need to social distance. So it is not that, okay, I have the mask so we can now all gather and have a holy huddle. We still need to watch our social distance. They work together. A little trick I wanted to demonstrate actually with the mask wearing. If you do have these with the metal at the top, you bend this before you put over the nose. If you wish, you can cross the loop before you put it over the ear, over the nose, over the other ear, and then you'll notice the gaping holes. You can tuck these in, and then you have a nice sealed over the nose, sealed hair, and then under the chin. So that's very important. We've seen situations where in meetings sometimes people keep pulling their mask up because it is sliding down as you speak. Those would not be suitable, and those are not masks you want to have to be continuing to adjust, or you will not get protection. So, masks. Masks protect you from COVID-19. That is the message. And in County Caroni, having worked with our teams for the last 12 months, yes, 12 months have passed, we have had swabbing teams going out to people's homes, swabbing teams facilitating drive-by swabbing, and not one member of my swabbing team has contracted COVID-19. Why? Because they wore their personal protective equipment. Personal protective equipment will protect you from COVID-19. For a person who is on the street, regular persons who are not healthcare workers, your mask will protect you. That's all you need. The level of PPE required is, of course, connected to your level of exposure. So a doctor who is dealing with intubating COVID-19 positive patients in ICU, they would wear way more than what we would, but what we are required to wear are the masks. And the interesting thing is, doctors who work with known COVID-19 positive persons have not been contracting COVID-19 because, of course, they know the status of the person. It is the rest of us when we are in public or gathering with others, we don't know their status, we presume they are not COVID positive, and then we lower our guard, and then we don't either watch our distance or wear our masks. So I want to encourage the population again to continue to wear the masks and wear them well to reduce the number of COVID-19 cases that we are experiencing right now. And the other thing that I have observed, even in my own workplace, is the awkwardness sometimes of coming into a space and seeing others not wearing a mask while you are wearing your mask. So what should you do? Well, you can ask the persons, gentle reminder, guys, don't forget you need to be wearing your mask. Or if it is they are saying, while we're eating, we're relaxing or whatever, then you need to remove yourself so that you are not exposed. Because what's the point of you wearing your mask? You are protecting others, and others are not wearing a mask around you. Then it means you are not getting the benefit of being protected by others when they wear their mask. And the other question I wanted to address was, well, why County Caroni? Are we special? Why do we have more cases than others? And the only answer I could really come up with is all it takes is 1 or 2 people. All it takes is 1 or 2 people to be infected. All it takes is 1 or 2 people to not wear their mask. All it takes is 1 or 2 persons to gather to eat, drink, be merry without a mask, and guess what? COVID-19 then starts to spread. All it takes is 1 or 2 persons becoming infected, returning home to their family, spreading it to 1 person in their family, who then goes to their place of work, and then spreads it to 1 person at work, who then takes it home to their family, and on and on. So I think that may be what has happened in County Caroni to explain why the cases have gone up. And of course, in February, we even had a cluster which Mr. Siramsingh referred to, where we had 1 person spread to 5 other household members, of which many of them were related, right? As a result of 1 person getting infected and taking it home to their families. And then we've had persons as well who have remained on our active list for quite some time. We've actually had somebody there for 40 days. So it's not as if we had 26 cases in February. There are persons who were positive from before, and some people do remain symptomatic for quite some time. But I would like to end on a very positive and a good note. The American Journal of Tropical Medicine and Hygiene published an article last year, 2020, that spoke to, the title was Health Systems Resilience, COVID-19 Response to Trinidad and Tobago, which some of us would have heard about, but I wanted to bring it back, where we, Trinidad and Tobago, were ranked number 1 in the University of Oxford based on our health system response. And you know what? Despite our many challenges, right, as a country, we demonstrated political will, evidence-informed decision-making, respect for science, and timely coordinated collaborative actions. These words are taken straight from that article published by Shelley Ann Hunt, Karen Peer, Roseanne Senrose, and Donald Simeon. These are the things that caused us to respond so well to a public health emergency and come out shining. So, that tells me we are a people that make decisions based on evidence, and we are a people that respect the science. The County Medical Officer of Health cannot reduce the number of COVID-19 cases in County Caroni by myself. The doctors and nurses, other critical members of the surveillance unit who do contact tracing and monitoring of the COVID cases, EMTs on the GMR-TT ambulances who come to our homes to do assessment and facilitate transfers to Couva Hospital or Cora, Trinidad and Tobago Police Service who are doing the monitoring to ensure that you adhere to quarantine. All of these people, they cannot help us to bring down the cases without you. We depend on you, the public, to continue to adhere to the protocols. And should we expect a rise in numbers? I would say no. Containment and reduction of numbers is possible as we do our part to wear our mask, wash hands, and watch our distance. So even as I close, I encourage us all to not have any other counties having a rise in the numbers. What was represented in County Caroni and County Victoria can end now as we continue to adhere to the protocols and enjoy the benefit of seeing those numbers decline in these counties. Thank you.
Thank you very much, Dr. St. Bernard. And I believe that we are all filled with additional info, but also with hope as we move forward to maintain the health of Trinidad and Tobago and move from management to control of the pandemic. We go now to the question and answer segment. We ask members of the media, please begin by stating your name and the name of the media house that you represent before placing your 2 questions forward for our panelists. We start with questions from Wired 868 this morning.
Hello, good morning, everyone. I'm Fayola Bostek from Wired 868. My first question would go to Dr. Hines. Dr. Hines, several people today have spoken about COVID-19 being still with us. I'm wondering, is the goal for us to get to 0 COVID cases, and how likely is that? My second question would be, if the goal, or if COVID-19 is likely to not go to 0, if we're likely to stay with some cases circulating, how do you expect our behavior to have to change going forward into the future?
Okay, thank you for the questions, Ms. Bostic. Now, the goal is, in the initial instance, while we still have a certain level of quote-unquote control over the population status, to get as close as possible to having 0 cases in the community, 0 cases transmitted. Bearing in mind, of course, as I said earlier, that one of the problems with this particular virus is the fact that you can have people who are asymptomatic cases. So while we think we are at 0, they are actually quiet spreaders. And that is the ongoing risk that we face with a virus that has nearly 50% of its patients being asymptomatic. So while the goal, yes, is to drive the transmission back down to 0, we do acknowledge that even though it is a challenge, the behaviors that you have alluded to and asked about are going to help us to keep the numbers as low as possible. And those behaviors are the same ones that we have been emphasizing. The hygiene, and by hygiene, we not only talk about the hand hygiene, but what we call respiratory hygiene or respiratory etiquette. And that respiratory hygiene and etiquette includes what we do when we cough, the coughing into a tissue preferably, discarding the tissue, washing your hands. If tissue isn't available, coughing into the crook of your sleeve. The wearing of a mask at this point in time continues to be a necessary tool and continues to be an effective tool in reducing the risk of transmission. As we move into the phase of vaccination, as we get additional information on how well the vaccines function to reduce the risk of transmission, we review and we see what remains necessary and what doesn't. But the multi-layered approach, the hygiene, the masks, the distancing, the vaccines, all of these things together are parts of the behaviors that we're going to need to adjust to and adapt as what we call the new normal, to reduce the risk of COVID-19 blossoming and ballooning into a widespread epidemic, as we've seen happen in other countries. So yes, there is the drive towards getting down to 0 transmission. And yes, there is the acknowledgement that this may be a challenge and that certain behaviors are going to be required of us to keep the cases as low as possible and to continue to work towards 0. So thank you for your 2 questions.
Thank you very much. We go now to AZP News, please.
Hi, good morning. Priya Bihari, azpnews.com. My first question to Dr. Hines is basically a follow-up to Fiola's questions. The whole issue of our COVID cases being reported very low. I think over the last week and a half, we had 1 case, 7, 5, sometimes 0. But I take note that the minister and the CMO has stressed. I think for the year we have had over 400 or 500 cases or new cases. But there seems to be a sense in the population that we're not taking it on. In other words, there is really that large effect of COVID again in the country. And people I think they are gathering more, they're having parties, etc. Although maybe within the confines of their homes. Is this something that the ministry is looking at? And have you found that this is the case in the new cases that are coming up now, that people feel that they can take a little more risks now? Thank you.
Okay, thank you for your questions. Now, the purpose of the communication that we have on this bi-weekly basis is precisely to keep in the forefront of the public's understanding, knowledge, perception, the fact that there is still virus in the population. While we don't want people to walk around with a sense of dread or anxiety, what we do want them to walk around with is a sense of purpose and a sense of protection, the responsibility for protection lying largely in the behaviors that we are encouraging you to follow. So while we do know that there will be the mental health aspect related to fatigue with following the instructions. At this point, a year down the road, new behaviors should really have been fairly well entrenched in your behavior set. It takes less time to potty train a toddler, I think, than to get a new behavior installed in your brain between last year and this year. So we're at the point where we should have this fairly well down. We do note that there will be divergences, human beings being what they are. Not everyone always follows the rules, and we take note of that. Yes, the ministry is aware of that. There is nothing that we can do beyond continue to encourage good and sensible decision making and to provide the information on why the decisions that we're suggesting are the sensible ones. Provide the evidence on how the behaviors that we're advocating help to reduce risk. And we're going to continue to do that. We are thankful for the points when people point out that yes, there's still these behaviors that may deviate from the suggested, from the accepted, and it comes down to personal responsibility. It comes down at this point to what each individual chooses to do in the fight against COVID to reduce the risk of transmission either to themselves or from themselves, and actually both to and from themselves. So all we can do is continue to provide the information that we are currently providing and continue to advocate for those sensible behaviors, for adherence to the new normal as we continue to reduce the risk of spread by what we're currently doing.
Thank you, Dr. Hines. And I just wanted to get a sense as well from Dr. St. Bernard about some of the behavior patterns that she's seeing or that her team is seeing in County Caroni.
Thank you, Ms. Alcantara. In terms of behavior patterns, I think that generally, just as we stated at the beginning, many people, we want to start with the positive, many people are adhering to the guidelines, but of course there is something that did contribute to the number of cases. And we did have persons literally, willingly stating that they did not wear their masks whenever they presented to work, and they would wear their masks when they were leaving the office to return home. Deeper contact tracing, because with contact tracing, we don't just call people once. So sometimes it's second and third time when you call to get more clarification on who else you may have been in contact with. You may then have one or two persons who are then coming forward, maybe a little more unwillingly, to state the issue of attending functions or parties. And this is something where sometimes people are feeling like, I don't want to incriminate anyone else. But the significance of coming forward with information that is relevant and significant in terms of protecting others is that you may literally save a life. Because remember, as we've said before, persons who become infected and then infect an older relative at home who may have the comorbidities, the hypertension or diabetes, and then end up hospitalized or worse, that is a very significant consequence. So I think in seeing these issues arising with the not mask wearing and the gathering, I think we need to not drop our guard and not be wary of doing well within this pandemic.
Okay, I'd just like to follow up on what Dr. St. Bernard just pointed out, because it's a very, very important point. As we work towards getting those lower numbers to trend towards zero, as we work towards the contact tracing in these smaller groups, it becomes even more vitally important that information on your potential exposures, your whereabouts, gatherings or functions or places that you may have attended, that information is shared with the public health personnel who are doing the contact tracing. It helps not only to identify whom you may have exposed, but it also helps to identify where you may have been exposed. And although the tendency may be to feel that you are then putting people under the spotlight, that's not really it's not the purpose of the contact tracing questioning. All we're really trying to do at this point is to figure out what people's greatest risks are as they move about, as they conduct their daily business. Where are people reporting that they may have been, what are they reporting that they may have been doing in the 2 weeks prior, that then indicates that this particular activity, location, etc., may present a higher risk. The importance of the mask wearing in the office is something else I'd like to emphasize, because the issue of indoor air circulation and the recirculation of infected droplets in the indoor air-conditioned, closed, no-window space is one of the factors that has been repeatedly noted in the medical journals as an increased risk factor for transmission of COVID-19. So whether it's indoor in an office, indoor in an air-conditioned church or a bar setting, the whole point is the indoor air circulation with infected droplets is one of the factors that has continued to spawn clusters of cases, and the mask wearing is one of the things that helps to reduce that risk by trapping the majority of those droplets as they leave your respiratory system. So it really is very important that we adhere to the mask wearing even in settings where we're comfortable with the people around us. It really needs to become a part of our new normal.
Thank you very much to our doctors. And just a reminder that Mr. Siram Singh is also here. We go to TV6, please.
Hi, good morning. Alicia Boucher from TV6. Anyone can take these questions. I know that most businesses, they have allowed their workers to come back out full-time. And you have been stressing the importance of wearing masks even when you're at the office. But there are people who are unable to keep a mask on for 8-9 hours because of different reasons, claustrophobia, other medical reasons. Some people are unable to function in a mask for very long periods. What would you suggest then that employers do in a situation like that, and what can be, perhaps done to mitigate or to counteract or, to provide, I guess, maybe some sort of alternative? That's the first question. Second question is, I just wanted to know whether or not the state quarantine facility, which I believe is the UTT campus, in the Caroni district would have had anything to do at all with the numbers that we are seeing in the Caroni County. Thank you.
Thank you, Ms. Boucher, for your questions. I will attempt to answer both. So regarding the first question, that is an absolutely relevant question, because I myself feel sometimes as if, oh my goodness. So what I do is I would go to the bathroom, because, it's just you in the bathroom. So sometimes if you do need to take more often a break from the mask, you would need to go somewhere where there is absolutely no one else around. In terms of the employers, perhaps, also if you have your own office, as in an actual space where there is a door that closes off so that there is no one with you, that would be a time when you cannot have the mask on. But as soon as someone enters the office, which is what I also have to do, you would need to place the mask back on immediately. Now, in terms of the employer's responsibilities or maybe their duties in terms of what they can do to help, even like something we're seeing in the schools, is they need to then put shields, if it is possible, to have shields built around desks so that you have your own cubby, and that desk is located the requisite 6 feet away. That may be something that we can look to exploring, where you would have some form of, and your chair would have to be located in proximity to the desk, such that when you sit, the air around you is not at all coming outside of that space to encroach on others. Stepping outside to take a break, like how, before when people wanted to smoke, they would go outside of a building because you're not allowed to smoke indoors. You may need to take more often some breaks and literally step outside of the office to take a gasp. Or if you have a vehicle, you may want to go into your car, turn on your AC, catch a breath. So there are different things that you can do so that you don't expose yourself or others that can be explored. With regard to your second question, which is the quarantine facilities, the quarantine facility within County Caroni is actually the home of football. The Debe facility is considered to be in County Victoria. So in terms of County Caroni and the home of football, we have not had a positive case for a very long time. I'm trying to remember the last month we would have had a positive, but nothing for this year. So we have not had any contribution towards our cases from persons who were quarantined at our state quarantine facility. So I hope that answers your question.
Okay, and just to add that the regulations speak to both the wearing of masks and the wearing of shields. So those individuals who feel unduly encumbered by the mask wearing, while a shield is less optimal, it is still some form of reduction of direct expulsion of droplets. So we can look at alternating between use of the two, or just ensuring that one or other is worn at all times. And there are mask guidelines on the Ministry of Health website, so we can always refer to those.
Thank you very much. And we go now to Newsday, please.
Good morning, everyone. Rihanna McKenzie from Newsday here. I'm hoping Dr. Hines can answer my questions this morning. What's the progress of the health minister's report to the DPP about someone promoting herbal products? Also, have any reports about fake drugs been made to the police officially? Thank you.
Okay, thank you for your two questions. The progress with respect to the minister's submission to the DPP will be best addressed by the minister. I will leave that for him to update you on. I am not currently aware of any fake drug reports currently being before the police service, but we can always look into that and verify that I'm correct, and we can update as needed.
Thank you very much. IETV, we're ready to field your questions now.
Great. Good morning, everyone. I'm Bina Mahir from IETV News. I have just one quick question for Dr. St. Bernard. You mentioned that a lot of fancy masks are being used and worn by a lot of persons. It is also being sold as well, and we have nothing against that. But is there any way that the Ministry of Health can regulate the type of mask? Because I know you all advise us the type that we should be wearing, but obviously it's not the case. Thank you.
Hi, thank you for your question. I think when it comes to the selection of masks based on availability from the stores, it would come down to personal responsibility, and based on the guidelines provided by the Ministry of Health and other reputable sources online, you as the public would have to make the choice to purchase or not to purchase based on suitability for protection against COVID-19.
Thank you very much. And we go to AZP News for a follow-up question, please.
Yes, morning again, Prior here, AZP News. I just wanted to do a follow-up to an issue I had raised some time ago. It has to do with the turtle nesting season that opened on Monday. The conservation groups are asking if they can get an exemption because the turtles usually nest at night, and this is something that they do all year, every year. So they were asking what is the status of this exemption, or if some representations could be made to them. So I don't know if Candice may be able to let the minister know about this. Thank you.
Thank you very much, Mr. Bihari. I will raise the matter with the executive. Thank you. We go to a follow-up from Wired 868, please.
Hello, good morning once again. My follow-up question has to do with the effectiveness of certain non-pharmaceutical interventions that we've seen trying to help reduce the spread of the virus around the country and around the world. There was a study coming out of Stanford in January this year that seemed to suggest that the restrictions, the more robust restrictions like mandatory closures, mandatory stay at home, were about as effective as the less restrictive measures, such as the mask wearing, the 3 Ws, as we said today. Could you explain maybe why that should be the case? And if it is the case, can we look at whether we should be looking into, reopening some of the businesses that are closed right now, and maybe that would stop the driving people into underground parties and stuff, if they were able to go to the bars, if they were able to go to cinemas, things like that. Do you think that's something we could look into?
Okay, thank you for the question. It's a multi-layered question. I'll take the first layer, which is why the mandatory closures versus the less invasive types of measures seem to be equally effective, and it's because they're basically utilizing the same principle, just on a mass action as opposed to an individual action basis. So all of these non-pharmaceutical interventions, as you rightly call them, meaning not a drug, not a vaccine, all of these interventions are based on reducing the probability of an infected individual coming into contact with a non-infected individual and transmitting virus. So when you have large-scale problems in terms of massive numbers of cases, rising cases, filled hospitals, etc., the mass action approach with closures, sometimes curfews, things that you would see applied in other countries, those are the fastest ways to reduce that probability of contact. As we get down to a state where in the population there's a lower level of viral circulation, the less invasive, or as you said, less robust measures, not really less robust, they're just less forceful, but they're still exactly as robust, because what they're doing is they are reducing the risk of infected droplets leaving an infected person's respiratory system and entering an uninfected person's respiratory system. Now, as we pointed out a little earlier, there are settings that are referred to as super spreader settings, places where enclosed indoor air circulation and overfilled physical capacity are going to raise the chance that any one person with virus in their respiratory system will spread that virus to several people just because of the physical setup of the place. So the bars, the party halls, those sorts of things, those are some of those super spreader settings, super spreader potential settings, and for that reason that level of interaction has been kept off the table so that we continue to reduce risk. Also to point out that the cinemas are open and that most businesses are open, so that the one or two areas of interaction that have been targeted are really the ones that have the highest potential for super spreader events and the highest demonstration in other jurisdictions of having resulted in multiple cases from one or two index individuals, one or two individuals ill in the first place. So the measures work, and they either work by mass action, keeping everybody out of everyone's way, or by individual action, keeping your individual droplets to yourself by the decisions you make, the mask you're wearing, the distance you keep, the places that you don't go to. And that's why they're seen to be equally effective. But the super spreader events need to remain off the table at this point in time.
Thank you very much, Dr. Hines. And we go now to Express newspaper.
Good morning, Kim Budram from the Express. One question, maybe with 2 points, probably for Dr. Hines. It's with regard to the rollout of vaccines for people with chronic illnesses. Of course, the vaccine uptake is voluntary, but is there any way of telling, maybe through the fact that people are registered with clinics in the various RHAs, how many people with chronic illness are out there potentially to be vaccinated? And as well, forgive me if this has already been explored, but there is some trepidation about vaccines among, some of the population. I don't know what the reaction has been among, let's say, the senior citizens. So I was wondering if there has been in the clinics or through the RHAs, maybe an outreach program specifically for them to help them to understand what the vaccine is about, and if there's been any feedback from them as to how they feel, are they fearful or anxious about it or willing, etc. I hope that was clear. Thank you.
Okay, so yes, we have been actively seeking the lists of individuals registered with the various chronic disease clinics, at least within the public system, also looking at those who may be registered on the CDAP system. And we have estimated that between those two, excluding overlap, we have somewhere in the vicinity of maybe about 80,000 individuals that would be so registered or would fall into those categories. we have seen that in the conversations that people are having, at least informally, that there is a certain level of confidence and interest in the vaccine because people have realized or recognized that the virus is much more likely to have adverse effects on you than the vaccine. We've seen where the people who've had the vaccine so far have had what they call the routine or mild, quote-unquote, side effects. Those effects just being your body's response to being vaccinated and to generating an immune response. So the pain at the site basically pointing out that you've had an injury, it is a needle stick, and the redness, the tenderness, those things, those are expected. The fevers that people mount, that feeling of what we call malaise, or sometimes people say they feel tired, fatigue, that again is an indication that your immune system is doing its job. It is producing the immune response and the chemicals in your body that are going to allow it to mount a better response the next time it sees COVID-19. But that response comes with a certain feeling in your body, that feeling of fatigue, the body pain sometimes that some people refer to. All of those are expected, and they are what we call self-limiting. They're short-lived. And the long-term benefit of having your immune system primed to respond in a better way to the virus is what we're seeing, is what the studies have shown. The studies have shown that across the board, whichever vaccines have been approved, you've seen a massive reduction in numbers of people getting severely ill. Even if they do get infected, they don't get severely ill. Death rates have been cut to nearly zero by the vaccination process. If you look at the global numbers in the countries that were driving the epidemic with their high numbers, we're now seeing the global population coming down the other side of that curve. You're seeing decreases in new cases, you're seeing decreases in deaths, showing that the vaccines have been effective. This new thrust towards vaccinating the global population is beginning to pay dividends already. And I believe that is encouraging people who would otherwise have had more trepidation to see that there is a massive benefit. And we have not really gotten the feedback that people are unwilling. They've gotten the feedback that people are curious about the side effects. They are hearing that people are saying, this is how I feel afterwards, but they're also noting that those feelings go away in a day or two, and that there's also medication for them. So you can take medication to reduce those symptoms if they are problematic. So really and truly, we're seeing where the benefit far outweighs any drawbacks, and we want to continue to get that message out there. So yes, we will look at the communication channels that are available at the health facilities, etc., to give this information to those in clinics so that they're better prepared to receive the vaccine when it is available.
Thank you very much, Dr. Hines. We have a follow-up question from TV6, please.
Yes, I am asking this question on behalf of a member of the public because I would have seen that question out there. If we get vaccinated, if you get vaccinated, do you still have to wear a face mask? And if so, at what point would we be able to not wear a face mask?
Okay, thanks for the question. This question has been asked in this forum before, but it bears repetition. The need for the face mask is, as I keep saying, it's an extra layer of protection beyond the layer of protection that's provided by the vaccine. Now, I think when Professor Carrington spoke about the vaccine, she mentioned the difference between what's called sterilizing immunity, meaning your immune system now doesn't allow the virus to take hold at all and you don't get infected, and the kind of immunity that is granted by most vaccines, where you may still be infected, but you are less infectious, you are less ill, and that gap, so to speak, between 100% sterilizing immunity and what most vaccines tend to provide is the gap that is then covered, quote unquote, by the wearing of the mask, by the physical distancing, and the use of all the other non-pharmaceutical intervention measures. It's really important to emphasize that when we wear the mask, we're not just protecting ourselves, we're protecting other people, and we're protecting them from when we don't even know that we're ill. So we protect both ourselves and others by the wearing of the mask. The vaccine provides its layer of protection. The mask provides an additional layer of protection. The physical distancing provides another layer of protection. And as we overlay all these layers, even though no one may be 100% foolproof, you get what we call that Swiss cheese effect. Swiss cheese being that cheese with holes. If you layer it, if you put enough layers, then eventually block anything from getting through. So that layered approach is the approach that we really like to take in public health interventions. The public health interventions being all the things that we've spoken about. It's also important to emphasize that at this point, there is a fairly large population of individuals whom we will not be able to vaccinate at this point in time, those being people under 18. So our ability to reduce the risk of transmission helps to ring fence and protect that population that can't currently be vaccinated. So we really need to keep all the layers in place to reduce the risk as much as possible.
Thank you very much to all our participants this morning. We have come to the end of today's media conference. I know the journey has been long, but we are starting to see the light at the end of the tunnel, and this is not the time to reduce our measures, not our time to stop being vigilant. Please let us remember to follow the 3 W's. Wash your hands, wear your mask, and watch your distance that you keep from between yourselves and others. Our collective efforts have been working, and that's why our numbers are low. But we depend on you to do all that you must do to protect yourselves and your loved one. Be safe, and of course, wear your mask.
Where you hustling now up to? This is the beach. You're supposed to be relaxing.
Well, I'm going to get some bacon shark.
Oh, all right.
Yeah, me and my boy, yeah.
Just remember, it's still a COVID out there. Beach or no beach. Yeah. Hey, you wash your hands? Where's your mask? You know what?